Hello everybody, welcome in. Welcome to the live stream everybody. Welcome. We're going to do some pharmacology on antibiotics today everybody. Welcome in. Hello. How's everyone doing today? Appreciate if you guys would give the like a live. It would help get this out to more people so we can help them on their upcoming exams and everything like that. I do go live every single day. Covering AMP topics. Today we're going to cover pharmacology. Hello everybody, welcome. How's everyone doing? Thanks for liking the live, guys. I really appreciate it. We're doing some antibiotics pharmacology review today. How's everyone doing today? Probably going to move this back just a little bit. Oh, that's a little better. How's everyone doing? Hello. Thanks for joining everybody. Hope that you are all having a good day. How's everyone doing? Do I have any videos up about the respiratory? I do have a TikTok video, and then I do have some YouTube videos as well on the respiratory system. They're on YouTube. I do upload all the TikTok live replays to YouTube. And then I have a playlist on YouTube. It has anatomy and physiology. Just anatomy and physiology. It should be in there. I think so. I'm taking a look right now just to make sure. I'm pretty sure. Yeah, I do have. Yeah, I have like one, but I can definitely do another video on that as well. How's everyone doing today? We'll go ahead and get started here now. How's everyone doing? Welcome. Thought I could escape farm for another 3 years. Yes. I gotta learn next year for psych. Oh my goodness, that is unfortunate. That is very unfortunate. I'm sorry to hear about that. I do love pharmacology though. It's definitely one of my favorite classes. We'll go ahead and get started here. If you are new here, my name is Ollie. I have a master's degree in molecular medicine. I was also a pharmacy tech for 4.5 years. And then I do go live every single day covering anatomy and physiology topics, pharmacology, pretty much anything that you guys would pretty much request. But we'll go ahead and get started now with number 1. Which of the following antibiotics inhibits bacterial cell wall synthesis? This is a great quiz for nursing students. Awesome. Thank you, Leslie. I really appreciate that. I'm not in med school, so I know nothing. These questions are more centered for nursing and pharmacy exams. So these questions are very relevant for, again, nursing students and pharmacy school. Medical students, it's definitely good review, but more questions are kind of more focused on like diagnosis and treatment plans. But still definitely good practice questions, and then pharmacy technicians as well. Actually, I have a pharm exam tomorrow. Good luck on your pharm exam. Alrighty. Again, if you're just joining, welcome. My name is Ollie. I do go live every single day covering mostly anatomy and physiology, but we are starting to do pharmacology as well and other things that you guys request. We are on number 1, which asks, which of the following antibiotics inhibits bacterial cell wall synthesis? I actually got my pharmacy tech license while I was in school. I got it my freshman year of college. You take the PTCB exam. You have to take a state and national exam. The answer is B, amoxicillin. The answer is B. It is amoxicillin. So amoxicillin is a beta-lactam antibiotic. Inhibits the bacterial cell wall synthesis by binding to penicillin-binding proteins. Tetracycline binds to the 30S ribosomal subunit. Azithromycin inhibits bacterial protein synthesis by binding to the 50S ribosomal subunit. And ciprofloxacin inhibits bacterial DNA gyrase and topoisomerase 4 to prevent DNA replication in bacteria. Number 2, which class of antibiotics has a risk of tendon rupture as a major side effect? Which class of antibiotics has a risk of tendon rupture as a major side effect? And if you are just joining us, hi, hello, and welcome. Thanks for liking the live. My name is Ollie. I do have a master's degree in molecular medicine. I was a pharmacy tech for 4.5 years. And I do go live every single day covering AMP and pharmacology. Hi, Ollie, hello. Passed my Hezi. Awesome. Congratulations, Liz. If we get a quick congrats for Liz in the chat, that would be awesome. The answer choice here is B, fluoroquinolones, such as ciprofloxacin, levofloxacin. They're associated with increased risk of tendinitis and tendon rupture. Really in like a lot of older adults or patients on like corticosteroids or those with like kidney disease. Moving on to number 3, which of the following antibiotics should not be given to children under 8 years of age due to teeth discoloration? Let me check the comments here. So if I miss a comment, I apologize. Yes, the doc is online. It is available. I have a link to it on my TikTok story. Is it over 12 in the UK? Okay. I know it might be different. This is based on US, though. Awesome. The answer is C. It is tetracycline. Basically, it binds to calcium in developing teeth and bones, leading to a permanent discoloration. Should not be used in children under 8 or pregnant women. Moving on to number 4. A patient with a history of anaphylaxis to penicillin should also avoid which antibiotic class? And hello to everybody that is just joining us. Welcome. Thanks for joining. Thanks for liking the live. My name is Ollie. I do go live every single day, covering anatomy and physiology and pharmacology. I'll start putting in some biomechanics, some pathology. We'll cover all the different healthcare-related disciplines and classes. And then I was a pharmacy tech for about 4.5 years. Pharmacology is one of my favorite subjects. Gotta take a drink of my zero sugar Pepsi. But number 4, we're on number 4. If you are just joining us, a patient with a history of anaphylaxis to penicillin should also avoid which antibiotic class? The answer is B, cephalosporins. They have similar structural components to them. So there's a little small risk of some cross-reactivity. Number 5, which antibiotic requires monitoring of serum through levels due to nephrotoxicity and autotoxicity risks? I need to fix that. Serum trial levels, not through, sorry. Serum trial levels. I'm craving zero sugar Pepsi. I got the wild cherry one too. It's my favorite one right now. It's on sale at Amazon Fresh. That's why. Why do I like pharmacology? I think it's just interesting learning all the different... If you think about pharmacology in itself, it is definitely one of the most like complex sciences out there. Like if you think about it, like there's 200 most common ones, and they have interactions. But if you take 200 to the 200th power, the answer is infinity. There are infinite interactions between different medications. So it's definitely incredible. But number 5, which antibiotic requires monitoring of serum trial levels due to nephrotoxicity and autotoxicity risks? The answer is A. It is vancomycin. Vancomycin can cause nephrotoxicity or kidney damage, and autotoxicity, which is hearing loss, especially in a higher dose or any sort of like chronic or prolonged use. Basically, you want to monitor those serum trial levels to maintain the therapeutic effectiveness. Moving on to number 6, which of the following is a first-generation cephalosporin? Yes, this is pharmacology. Yeah, that's okay. We're focused on antibiotics today. This is an antibiotic. Last time we did like some cardiovascular pharmacology. Today, oh my gosh, I did make the questions a little harder today. They're good review. I do have the detailed. I was a pharmacy technician for 4.5 years. I'm not a pharmacist. I did not go to pharmacy school. But I am still very well versed. I have taken undergraduate level pharmacology, and I took graduate level pharmacology with the medical students as well. The answer to number 6 is B. It is cephalexin. Cephalexin is a first-generation cephalosporin, mainly for gram-positive bacteria. So this is for like skin infections, urinary tract infections. Number 7, which of the following antibiotics is commonly used for community-acquired pneumonia? Community-acquired pneumonia. That I currently have community-acquired pneumonia. Oh my goodness, I'm sorry to hear about that. Hope you feel better. Number 7. These are pharmacy school exam questions. I do almost yeah. They're like pretty similar to pharmacy student questions and nursing student questions. The answer to number 7 is A. This is the generic for Augmentin. It's commonly used for mild to moderate community-acquired pneumonia, basically because of its coverage to Streptococcus pneumoniae. Number 8, what is the primary mechanism of action of penicillin antibiotics? They gave me Augmentin too. Awesome. Thank you, Jordan, for the 10 finger hearts. I really appreciate it. Jordan is a regular here. It's always a pleasant day when Jordan joins. Jordan loves pharmacology, right? And if you are just joining, welcome. My name is Ollie. I do go live every single day covering anatomy and physiology and pharmacology and other things that you guys request. We're not doing anatomy and physiology right now. We're doing pharmacology. And we're on number 8. What is the primary mechanism of action of penicillin antibiotics? The answer is C. It is inhibition of cell wall synthesis. Penicillins inhibit bacterial cell wall synthesis, basically binding to penicillin-binding proteins. This leads to bacterial cell lysis. Number 9. Which cephalosporin is commonly used to treat bacterial meningitis? Yeah, we can do immunology one day, for sure. I know absolutely nothing about it. I started in May, so you're giving me a head start. Perfect! I'm glad. What time do I go live for farm? It kind of depends on the day. Tomorrow, not sure what time yet. Tomorrow is unsure. It kind of depends. Probably in the evening, honestly. Probably around the same time today. Probably a little later in the day. Yeah, we can do some diuretics next. We're going to go live again on Friday with pharmacology. There's 30 today. It was a little shorter today because today's kind of been a big, busy day for me. So we'll do 30 questions. Again, the question is, which cephalosporin is commonly used to treat bacterial meningitis? The answer is C. This is a third-generation cephalosporin that penetrates the blood-brain barrier. It's highly effective against bacterial meningitis. Ceftriaxone. Number 10. Which of the following beta-lactam antibiotics is reserved for multi-drug resistant infections? Yeah, if you want these questions, if you go to my TikTok story, I have a link there. We are on number 10. Which of the following beta-lactam antibiotics is reserved for multi-drug resistant infections? The answer is B. It is meropenem. If you think of penem is basically lactam. That's a good way to remember it. It's kind of a broad spectrum one, basically reserved for a multi-drug resistant infection. moving on to number 11. Which macrolide antibiotic is commonly used for respiratory infections? Thanks for all the follows, and thanks for all the likes on the live, guys. I really appreciate it. If you are just joining, welcome. My name is Ollie. I do go live every single day covering anatomy and physiology and pharmacology. I do have a master's degree in molecular medicine. And then I also was a pharmacy tech for 4.5 years, and I do love pharmacology. I think my top three, I guess I have a top 5 favorite classes. I loved anatomy and physiology, pharmacology, biomechanics, pathology, and I had a cardiovascular physiology class that was really fun. Number 11, which macrolide antibiotic is commonly used for respiratory infections? It is azithromycin, or the Z-Pak. It is used for respiratory infections such as bronchitis and pneumonia, sinusitis. Gentamicin, mostly used for gram-negative infections. Levofloxacin is a fluoroquinolone. It's not a macrolide. And metronidazole is for anaerobic infections. Number 12, which antibiotic can cause a prolonged QT interval and should be used cautiously in patients with heart conditions? Do I have bundles we can download? I'm a new Yes, I do. They're on my website. It's linked in my bio. I do upload these videos to YouTube afterwards, and I do have study guides in my bio, my TikTok bio, and then I also have a link in my story. I don't have a pharmacology bundle up yet, but I do have an anatomy and physiology bundle up. My YouTube is my name. My YouTube is my name, but it is also linked in my bio. We just hit 1,000 subscribers on YouTube, which was awesome. Thank you guys so much. If you are already subscribed or are going to subscribe, I appreciate it a lot. But number 12, which antibiotic can cause a prolonged QT interval and should be used cautiously in patients with heart conditions? The answer again is A. It is azithromycin, a Z-Pak. It can cause a prolongation of the QT interval, basically increasing the risk of a fatal arrhythmia. So with patients with existing heart conditions, you want to be careful with azithromycin. Let me put YouTube here. Again, my YouTube is my name, or it's linked in my bio. Number 13, what is a major adverse effect of aminoglycosides such as gentamicin? Number 13. My junior, my undergrad for molecular biology and biotech. Awesome. Do I have more pharmacology videos? I do have one up there. I just started doing pharmacology. Pharmacology is definitely going to become a regular thing around here, for sure. I will definitely at least be doing 2 live streams a week on pharmacology. And then I try to mix up the anatomy and physiology topics as well. But fourth-year pharmacy student at Xavier University of Louisiana. Awesome. Congratulations. You're almost done. Finish strong. 13. Again, here we have, what is a major adverse effect of aminoglycosides such as gentamicin? The answer is B. It is nephrotoxicity. Aminoglycosides such as gentamicin can cause nephrotoxicity mainly by damaging the renal tubular cells. Mainly whenever you use it for long periods of time, so prolonged use, or in high doses. What days and times you should please share? So, any videos on patho? Not yet, but there will be soon. I think the easiest way to remember classifications and main uses is flashcards. That was my biggest way. I definitely would like to make a physical flashcard to send out to you guys as well. That would be fun to do. It's definitely a goal of mine. Number 14, which of the following antibiotics must be taken on an empty stomach? What times do I go live? It kind of depends. I will be going live on Friday. The time is still a little to be determined, probably like afternoonish, between like 1 and maybe like 1 to 2 p.m. probably on Friday, Eastern Standard Time. All my times are Eastern Standard Time, by the way, as well. Tomorrow, it'll probably be later around this time. I would say probably same start time as today for tomorrow. But Friday will be there. And then I'll also go live on Saturday as well. Not sure what time. I'll probably take a little poll as to see when people would like me to go live. But again, if you are joining us here, we are on number 14. Which of the following antibiotics must be taken on an empty stomach? Which of the following antibiotics must be taken on an empty stomach? The answer is C. It's tetracycline. It must be taken on an empty stomach. Basically because food, mainly dairy, and any sort of like antacid containing like calcium, magnesium, or aluminum, it will decrease the absorption by binding to the drug, and it will reduce its effectiveness. So it should be taken on an empty stomach. 15. What is the mechanism of action of macrolide antibiotics? Yeah, no problem. Thank you guys for joining. I do appreciate it. And I appreciate all the likes on the live. I appreciate all the follows. You guys are awesome. You guys make this so much fun. Definitely happy doing this. Yes, so we're doing 30 questions, so we're about halfway through. So the answer here is B. It is inhibiting protein synthesis, and someone has asked at which ribosome. It's at the 50S ribosome. So macrolide antibiotics, that's going to be an antibiotic such as erythromycin, azithromycin, clarithromycin. They bind to the 50S ribosomal subunit of bacterial cells, and it would prevent bacterial protein synthesis, basically inhibiting its growth. Moving on. Number 16, which antibiotic class can cause photosensitivity and should include sun protection counseling? Oh, for sure, even though I already passed one. Yeah, revision definitely doesn't hurt. I appreciate the follow. Thank you. Wait, I literally have an exam on this on Friday. Is it just on antibiotics? That'd be great. Pharmacist here. Great review. Awesome. Shout out the pharmacists. You guys do a lot of work. I was a pharmacy tech for 4.5 years. Pharmacists have it very rough. Again, we're at number 16. Which antibiotic class can cause photosensitivity and should include sun protection counseling? So not all the ones that end in mycins are macrolides, but a lot of them are. The answer choice to 16 is B. Sulfonamides. Basically, that's kind of like Bactrim. That's an example of one. They cause photosensitivity, making the sun more susceptible to sunburns. So basically, those patients should be advised to use sunscreen and certain protective clothing while taking those antibiotics. Number 17, what is a major contraindication for fluoroquinolones, such as ciprofloxacin? Thank you for the rose, Anne. How many hours should one study for pharmacology? I think it depends. I'll thank you for the rose, Bianna. That kind of depends. I don't know. I don't think there's really a good amount of time to study for pharmacology. I'm trying to think how much I studied for. I studied quite a bit. But also, I worked as a pharmacy tech whenever I studied it. So I definitely had like a lot of review while I was at work. I would definitely say for like an undergraduate entry like level course, maybe 8 to 12 hours a week potentially. Nursing, pharmacy, medical students, probably like 12 to 20 hours a week. It's a very core subject. Maybe for your board exam, maybe like just a brief like 2 to 3 hours a day for like a month to 3 months. Number 16. I'm sorry, number 16. Number 17. What is a major contraindication for fluoroquinolones such as ciprofloxacin? The answer is B. Myasthenia gravis. Basically, those patients, they can exacerbate their muscle weakness and lead to respiratory failure. So there's a current black box warning for that risk. Hi, D-Ice, how are you doing? Hello, everybody. If you are just joining us, welcome. My name is Ollie. I do go live every single day covering anatomy and physiology, pharmacology. We're going to start going over some pathology and pathophysiology. I do have a master's degree, and I was a pharmacy tech for 4.5 years. We're going to move on to number 18. Which antibiotic is commonly used to treat UTIs, but is contraindicated in late pregnancy? I'm good. Just dropping by. Just got home. Awesome. It's good to see you again. D-Ice is regular here. You've been around here a long time now. I feel like you've been in the lives like pretty much since I started doing lives. It's always good to see you here. Number 18. Which antibiotic is commonly used to treat UTIs, but is contraindicated in late pregnancy? If I missed any questions, I apologize. Definitely feel free to repeat your question. Sometimes I miss them when I'm like writing on the screen or looking at the screen. Number 18, which antibiotic is commonly used to treat UTIs but is contraindicated in late pregnancy? The answer is nitrofurantoin. A. Letter A. So it is a first line of treatment in UTIs, typically, but it is contraindicated in pregnant women or pregnant patients. Basically near term, so about like 38 weeks, essentially due to the risk of hemolytic anemia in a newborn, basically caused by immature red blood cells, the enzyme systems. And hello everybody, who everybody just joined. My name is Ollie. I do go live every single day covering pharmacology, anatomy, and physiology. Basically anything that you guys are requesting. We will be live again on Friday to cover pharmacology. Tomorrow will be anatomy and physiology. We're going on to number 19 now, which asks which antibiotic is used to create C. diff infections. Appreciate all the follows, everybody, and I appreciate all the likes on the live. I think when it comes to pharmacology, I think the best way is to make flashcards and to use flashcards. And then I think in terms of like the physiology of pharmacology, I think explaining things out loud and drawing things out and drawing out the pathways is the best way. So I think both a mix of both. We are on number 19, which antibiotic is used to treat C. diff infections. What was the answer? The answer is B. Metronidazole. Basically, for mild to moderate C. diff infections, it will work by interfering with DNA synthesis in anaerobic bacteria. Basically leads to bacterial cell death. Some people are asking... So what about Mike? So vancomycin is the preferred first line of treatment, yes, but vancomycin wasn't one of the answer choices. Had vancomycin been here, yes, that is the answer. And if you have both of these, you would answer vancomycin because that is the first line of treatment. But it is still a treatment for it, if that makes sense. Basically, metronidazole is only used if vancomycin, and I think there's another it's like phytomoxicin. But it does. Clindamycin can actually become a cause of C. diff infections. It can disrupt your gut microbacteria. Basically, it kind of allows it to grow a little more. Number 20. Which of the following antibiotics inhibits folic acid synthesis? Yes, Sean. That is correct. That's the one. I couldn't think of the name at first. And Tiffany. Tiffany also put it in there. Thank you, Sean and Tiffany. But clindamycin can cause C. diff, so it wouldn't be used for treatment. This is more so for nursing pharmacology and like pharmacy student pharmacology questions for sure. Medical students, that's a good review. I didn't really make it centered around that, but definitely would be a great review. Yes, vancomycin. Yeah, vancomycin is definitely like the first line of treatment, but again, it just wasn't one of the answer choices. Number 20, which of the following antibiotics inhibits folic acid synthesis? The answer is B. It is Bactrim. So TMP, SMX, or Bactrim inhibits folic acid synthesis by blocking the sulfonamide component, so dihydroparate synthase. Sorry, I can't talk today. My mouth is really dry. I've been talking all day, so my throat's a little dry, so I keep messing up on my words. I apologize. But basically, this effectively stops bacterial growth through folic acid synthesis. 21. A patient taking Rifampin for tuberculosis should be educated about which common side effect? Thanks for all the follows, everybody. I really appreciate it. The fact that I learned these an hour ago, I don't remember. That's okay. You can get this this worksheet on my website. It's linked in my TikTok story. The free version is on here on TikTok, and I do upload it to YouTube afterwards. Should be later today or tomorrow morning it'll be up. But that would be free as well. There's a good chance it might be. Jackie. Sometimes I have a little bad... I'm bad at mixing them up. But the answer choice here is B. It is orange-colored urine. It's very harmful, but this can include sweat, urine, tears, turning them like an orange-reddish color, basically. The patient should be educated that it's normal. No sign of harm. 22. Which antibiotic is used for prophylaxis for endocarditis and high-risk dental procedures? I examine it on Friday. Awesome, good luck. When will I be uploading? It'll be up later. It just kind of depends on when it upload. So I have to download it to my phone, and then I have to upload it to YouTube. So it kind of just depends on the processing time of it downloading from TikTok to my phone and then uploading it to YouTube. So it'll either be later tonight or tomorrow morning. Answer to 22 is B. It is amoxicillin. So whoever asked for dental students, definitely this is a good practice for that as well. I think it's a great review for anybody who needs to learn pharmacology. Again, the questions are more centered around nursing pharmacy questions and pharmacy student questions, but it's still a great review. 23. A nurse is reviewing a patient's medication list and notices they are taking warfarin. Which antibiotic should be avoided due to increased bleeding risk? And hello to everybody that just joined. My name is Ollie. I have a master's degree in molecular medicine, and I was also a pharmacy tech for 4.5 years. I do go live every single day covering pharmacology and anatomy and physiology. I do love doing this. This is so much fun. I appreciate you guys. You guys make this so much fun. So definitely happy to be doing this. Love you guys. Yes, Jackie. Jackie is correct. The answer is B again. Ciprofloxacin. So ciprofloxacin is fluoroquinolone. It inhibits cytochrome P. I want to write it down, so I don't. Sometimes I might say it out loud. I have to write it down sometimes to remember. P450 enzymes. This increases warfarin levels. Basically, it would significantly increase the risk of bleeding. Moving on to 24, which antibiotic is most commonly associated with the risk of C. diff infection? And we kind of mentioned that a little earlier. We explained. Yeah, sorry, Jay. Sorry, guys. Sometimes I make the questions so I have my own question. I make questions and I have a question bank. Yeah, I did give you the answer. I make the questions individually and I have a question bank. And I have a randomizer, and I randomize it, and sometimes, by God's intervention, sometimes a lot of the answers end up just being B or C. So, back to back to back. So the order of them kind of comes in I make them individually. The questions are made individually, and then I give them all a certain number, and then I randomize those numbers and then put them in. And sometimes all the answers end up being B in a row. But the answer is B. Is clindamycin. We talked about it earlier. Clindamycin affects the gut microbiome, basically allowing C. diff to overgrow. Basically, it'll cause severe diarrhea and colitis. 25. A nurse is teaching a patient about metronidazole. What important dietary restriction should be included? Pharmacy student year 3. These questions are helpful. Awesome. I'm so glad to hear that. It's Clinda. I've had C. diff. It's clindamycin. Sorry to hear that you've had C. diff, Allie. That is not funny, but also very ironic. It is always funny when people are I took pharmacology in undergrad, and yes, most would, but clindamycin is the most commonly associated one. Thank you, Zor, for the rose. Appreciate it. Thank you guys so much. You guys are awesome. Number 25, a nurse is teaching a patient about metronidazole. What important restriction should be included? Dietary restriction. It is to avoid alcohol. Avoiding alcohol. So it interacts with alcohol. It would cause severe nausea or vomiting, flushing, hypertension. When I was in college, there were so many people that would go up to the bar and they would pass out and stuff and have to go to the ER, mainly because they were on a medication that they weren't told that they need to avoid alcohol with. That happened pretty much every weekend in college. I saw it all the time. Number 26. A patient is prescribed doxycycline for acne. What patient education should the nurse provide? We're on number 26. A patient is prescribed doxycycline for acne. What patient education should the nurse provide? Yeah, they do get rid of all the bacteria. I hate taking antibiotics. Last time I had an antibiotic, I got my wisdom teeth out a couple years ago, and oh man, when I take an antibiotic, it just makes me feel so bleh. The answer here is B. It is avoid direct sunlight. Doxycycline increases photosensitivity, which would make sunburns more likely to occur. So patients should be advised on sunscreen and protective clothing. 27, a patient on vancomycin IV develops flushing, hypotension, and a red rash. What is the most likely cause? Cat wants some attention. So if you hear him meow, it's because he wants some pets. But he gets plenty of pets when he's not live streaming, so he's definitely not neglected. I actually have Crohn's too, so double whammo. Oh my goodness, I'm so sorry to hear about that, Allie. What did we say was similar? You helped me pass my T's exam today. Can't thank you enough for these lives. Thank you so much, Anne-Marie. Congratulations. Can we get a congratulations in the chat for Anne-Marie? I'm so proud. You should definitely be proud of yourself. Congratulations. That is awesome. Very happy for you. Very, very happy for you. Awesome. Thank you, everybody, for putting that in there. Yes. We love a supportive community. Thank you, everybody. But seriously, congratulations, Anne-Marie. Good luck and keep up the hard work in your studies. Number 27, a patient on vancomycin IV develops flushing, hypotension, and a red rash. What is the most likely cause? The answer is B. It is the red man syndrome. Basically, so rapid infusion of vancomycin can cause histamine release, which is known as like our red man syndrome, so a slower infusion, and an antihistamine could prevent that. Anaphylaxis would be an airway compromise, Stevens-Johnson syndrome, and is an allergic reaction when you have blistering skin lesions, not necessarily flushing. And then serum sickness, it's sort of like an immune complex reaction, more so for like fever and joint pain, not really just flushing. Awesome. Alrighty, moving on to number 28. What antibiotic can cause irreversible peripheral neuropathy? And hello to everybody that just joined us. My name is Ollie. I do go live every day covering pharmacology, anatomy, and physiology, mainly for whatever exams you guys have coming up, HESI, TEAS, NCLEX, Plex, just, your classes in general. Thank you, Paul, for the heart. I appreciate you guys. Thanks for all the follows and all the likes on the live. You guys are awesome. I love you guys. We are on number 28 now, if you are just joining us. And then last couple questions here. My NCLEX soon, and I love this. Awesome. I'm so glad. Thanks for sharing the live as well. Number 28, which antibiotic can cause irreversible peripheral neuropathy? The answer is B, nitrofurantoin. So mainly with long-term use, it can cause peripheral neuropathy. So it can definitely become permanent. 29, a patient on gentamicin develops ringing in the ears and dizziness. What should the nurse suspect? What should the nurse suspect? So for metronidazole, yes. So this also causes this. For whoever asked that, I think I saw that question. Number 29, a patient on gentamicin develops ringing in the ears and dizziness. What should the nurse suspect? The answer is A, yes, ototoxicity. So gentamicin, which is an aminoglycoside, can cause ototoxicity. Number 30, our last question here, everybody. Which antibiotic can cause a metallic taste and is used for anaerobic infections? This one is known for its metallic taste, if anyone has, unfortunately, had the pleasure of taking it. I feel like you can smell it, too, whenever I would count these. Awesome, guys. It is B. This is our Metro. It is well known for its metallic taste. It's commonly used for anaerobic and protozoal infections as well. That was all the questions that I did have planned for today. I hope this was helpful. I'll leave this up here for just a sec. I will upload this to YouTube afterwards. This will be on YouTube. It's my name. I do go live every day, covering Pharm and A&P. And I do have study guides. I don't have Pharma ones up yet, but I will soon. They're on my website, so on MedZeg. And this is linked in my bio. Both of these are, at least. Let me see some of the questions. Thank you. Yes. Yep. Everything. Am I doing Pharm again tomorrow? I will be doing Pharm on Friday. So this is linked in my TikTok story. The exam is. Thank you. Yes, thank you all. I appreciate all of you guys. You guys are awesome. I love you guys. Thank you guys so much for all the likes and for following. Not the same time every day. Tomorrow will probably be the same time. I go live Eastern Standard Time. I would say tomorrow I will probably be live. Where can I view more Pharm videos? I personally like Ninja Nerd. He's definitely one of my favorites. But hopefully we're going to get quite the video bank of pharmacology videos up here soon. Do I know what topic on Friday? No, I don't. It will be pharmacology, but my website has my email, and if there is a popular request for a certain type of pharmacology, send it to my email at ollie.medzeg@gmail.com. Thank you so much. Looking forward to viewing your Pharm stuff. It's TikTok, my full-time job currently, and also I do tutoring. Tutoring is pretty much full-time. I'm applying for PhD programs right now. Their funding is a little wonky right now, but waiting to see kind of what the funding for that looks like this year. Maybe I'll hold off till next year or something. But for now, I've just been doing this and tutoring while I'm waiting on those applications and seeing what the financial aid looks like and whatnot. Any other quick questions before I get going here? I'll stick around just for some quick questions. I was just saying, it was my master's thesis. Oh my gosh, that's so cool. I actually have not heard of anyone doing that for their master's thesis. But again, thank you so much, DS. Yeah, thank you. It's good to see you again. Hope you're doing well. Have a great rest of your night. But if anyone has a specific type of pharmacology they'd like me to make questions for, definitely let me know. Yeah, definitely let me know if you guys have any questions. Tomorrow will be anatomy and physiology. The time tomorrow, I want to say, to be safe, probably like maybe 4:30 p.m. Eastern Standard Time, I want to say. I wish I had the time to go into deep mechanisms. I did my master's thesis on the use of AI in studying biological age. It's really fun. And like longevity and stuff. It was a lot of fun. Any other quick questions before I get going? Thanks for following. I appreciate it. And thanks for liking the live, guys. You guys are awesome. I love you guys. I'm in CRNP Pharm class this semester. Wow, so much to learn. Yes, I know. It is a lot to learn, unfortunately. Thank you for the odds. How do I learn big chunks of info like that? Hurts like, am I Hungarian? Yes, I am Hungarian. Yes, my grandfather is from Hungary. Normally people guess Polish, but it is Hungarian. How do you learn big chunks of info? So, is this 1 or 2? What do you mean by 1 or 2? Normally, it's just antibiotics. So big chunks of info, like pharmacology, I think the best way is to start with flashcards and learn the names, their classifications, their uses, their mechanisms of action, and then for going in depth on the physiology of pharmacology, I think drawing stuff out and practicing it that way is definitely the way to go. When will this be posted on YouTube? It'll be later tonight or tomorrow morning. It just kind of depends on the time it takes to process. How to learn more info in a short time while understanding. Definitely practice explaining things out loud. So if you were like reading through a section of your textbook or your lecture material, read the title of that slide or the title of the section and think, what question am I trying to answer? Like, what is this trying to accomplish? What am I trying to accomplish by reading the following information? Then you go through, read it, look away, and see if you can answer that question from memory with what you just read. That's definitely my recommendation. All right, I do have to get going. Are there any other just quick questions here before I go? Anything else that's quick? I do appreciate everybody joining. Again, it'll be on YouTube later. I do have study guides on my website. Those are both linked in my bio. And then if you would like the exam, it is linked in my TikTok story. I do appreciate all the follows and all the likes that you guys put on the live stream today. But I'll be back tomorrow. See you tomorrow. But I will see you guys tomorrow. Again, thank you so much. You guys are awesome. Thank you guys so much. Again, my name is Ollie. And I will be going live every day. But see you guys tomorrow.